Hello everyone and welcome to this episode of the Do More podcast. I am Tia Wynn, the MEL officer here at the foundation, and I'll be your host today. We have a very exciting guest, and you may know this saying like jack of all trades, master of none. Well, Prof. Cathy Draper is jack of all trades, master of many, and has the busiest travel schedule of anyone I've ever met in my entire life. From sports science, sports medicine, community health, ECD, and I guess the main reason why our paths have crossed lately is your work with the digital assessment tool, Mazi Umntanakho. So thanks, Cathy, for joining us today and fitting us into your schedule.
Thanks for having me.
So before we dive right in, you know our paths have converged a few times in the past few years, and the foundation is all about play. So I have a playful check-in question for you that you'll answer at the end of the show to keep our listeners in suspense. So, I mean, especially because you travel so much and oftentimes in very rural places, I would want to know, what is the most random thing that you always pack along with you? I'm not talking like your toothbrush, I'm talking like a random thing. And has there ever been something that you've forgotten that you just actually couldn't live without? So you can give a think on that, and we'll come back to it at the end. But let's jump right in. Can you maybe tell us a little bit more about the Mazi Umntanakho social emotional digital tool?
Cool. So this is my first foray into the tech space. So it's been a really exciting project, and it came at a time where we're working, much more in partnership with organizations like the Do More Foundation, so community-based organizations working in ECD. And a lot of our research previously has looked at other aspects of early childhood health and development, and it just really seemed that there was this gap for something around social emotional development. And I mean, many of these projects have somewhat random starts, and I'd been collaborating for a number of years with a colleague in California, and we'd tried to apply unsuccessfully for some funding. And the last funding application, which I think was in 2021, was around developing some kind of digital tool, with me knowing very little about it. And then a network was actually started called the Ceres Network, which stands for the Connecting the EdTech Research Ecosystem, funded by the Jacobs Foundation. And this colleague, emailed me and said, another colleague of mine in California started this network. We didn't get the funding, but, they can do all the tech work. What can you do with $25,000, to actually do the co-design work? And so that's really kind of what triggered it off. And we worked with these people who are experts in human and computer interaction and the co-design of these kind of interventions. And what was really exciting is that in the tech space, and with the people that we were working with, that the notion that you would design anything without the community's involvement was just kind of not even an option. And so the community engaged approach was kind of inherent to the whole process, which is not always the case in the public health field that I work a lot in. So we worked then in partnership with some colleagues there and did a whole lot of focus groups and discussions and, meeting up with different community organizations, including in rural areas, to try and get their input on what this could look like. And starting off just to say, is this even important in your work? What are you doing? Could this add value? What's important? And then what could actually work? And so we've been working at the co-designing and then piloting and then tweaking the tool. And at the moment, we're busy still working with organizations, including Do More, to actually now train the trainers who then going to be training early childhood development practitioners to actually use the tool. And very, very briefly, the tool is essentially a screening tool on WhatsApp. So it functions very much like a chatbot, it is a chatbot, and it assesses social emotional development and mental health of young children 3 to 5 years. It provides feedback on the assessments in a very simple format using a traffic light system. And then it provides some resources that we've developed that cover some very basic and general aspects of social emotional development and mental health for this age group. And we have it available in pamphlets with kind of more text-based information, infographics that capture a key message, and then videos that actually talk through the pamphlets. And we're very proud to say we have it in 10 languages.
Awesome. And I love what you're saying about like really focusing on community and the voice of the community being so prominent. So yeah, I think that kind of leads straight into the next question around your work extensively. Some of it has been in the early childhood health and development across vulnerable communities. And could you share with us what drew you to this field and your diverse academic background? How does this like inform your approach to research?
It's really interesting. I did another interview for something completely different last week, and they asked a similar question. So it's been really, really interesting to kind of think about how I got here. And I started studying psychology, and I actually studied war veterans, which has nothing to do with ECD, and then worked in at medical school at the University of Cape Town for a number of years, teaching first-year medical students or doing group-based learning. And that was very much an introduction to primary healthcare and learning different professional skills. But I think those, apart from honing kind of my research skills, what those topics really helped me to see is what is the very complicated and messy context of South Africa, understanding like from, looking at the military and war and whatever in South Africa, understanding what were some of those really harmful dynamics around, during apartheid and how those affected people and the legacies of those, and then being exposed more to the health system was really then seeing, okay, but what are some of the social and economic and kind of cultural challenges that influence health at a family and a community level? And so it really exposed me to, I think, the reality of what has happened in our country. Obviously, I have a very limited understanding, and particularly as a, very privileged, white, highly educated person, very aware of my kind of positionality in that, but it kind of helped to fuel a sense of wanting to do what I could to bring about more social justice in our country, and using research as a vehicle for kind of bringing about some kind of social change and making a difference. And after I finished my PhD, I got this postdoctoral research position at the UCT department at the Sports Science Institute, and they were looking for a qualitative researcher to evaluate their community-based health promotion program, which was essentially an outreach program. And what that did is it just got me all over the show in terms of going to visit different communities in Cape Town, meeting, schools, seniors groups, adult walking clubs, like all over the show, and just meeting these really inspiring people, but also learning more about the challenges that they've faced and how choosing, making healthy choices is really not always easy, which is what you learn theoretically in primary healthcare, make the healthy choice the easy choice, but really seeing the reality of that in South Africa. And obviously the same applies for development as well. And I did some work in primary schools, and then also got involved with some evaluation projects with the Laureus Sport for Good Foundation, who were upstairs in the building. And that, again, took me all over South Africa to go and evaluate and meet and evaluate their community programs that they were supporting. And just repeatedly incredibly inspired by the kinds of things that I saw and the people that I met. And then I did my first project with preschools in Alexandra Township in Johannesburg about 15 years ago. And just that really kind of was the light bulb moment for me. Then just, seeing what a difference kind of early intervention and having that really solid foundation in place, but also seeing around you what the different social challenges were, and realizing that this is such a critical time in development, that if we can help children get on the right path, we can't do it all, but that's really going to help them face many of these challenges in a much better way. So that kind of lit the spark, and there was, then looking into what research had been done, there just really wasn't a lot on early childhood. And we focused a lot then on gross motor skills and physical activity and those kind of things. So we were able to do some research in those areas and contribute to the kind of greater research globally, from low middle income countries on many of those things. And then kind of steered towards cognitive development. And I think then really started to see that in other countries, particularly high-income countries, if we're thinking about health behaviors in young children, it's generally, not taking into account things like food insecurity or, HIV and also, infectious diseases. And talking about obesity prevention in our context really doesn't resonate. It just doesn't land well. And so it helped us to really see how do we see those as important behaviors, because they still are important, but how do we put that in the context of a much broader understanding of early childhood development? And so if you're encouraging a caregiver to get their child to have a regular bedtime, like how do you then link that to how important sleep is for kind of concentration and attention and those kind of things, and behavior and emotional regulation? So it really, over the years, I've just begun to see it in a much more holistic way. And obviously social emotional development is just part of that. It's not everything, but it's seeing how do these things relate together, and ultimately how does it help children get ready for school. And I think what drives a lot of what we do is, optimistically or not, like we believe that every parent and every caregiver wants their child to do well. They want them to be ready for school. They want them to be healthy and thrive. And so we try and kind of tap into that.
For sure. And what I love about the Mazi tool is that the pictures are so easy to understand, and it feels like you can touch on a broad range of topics like in such a gentle way. So I really love that. I guess the kind of focus is on the digital part of this tool. And I mean, these tools are often praised for how scalable they are and efficient they are. So what are some of the key strengths or advantages that you've observed using the Mazi tool in assessing young children?
In thinking about this, it's helpful to say there's tools that are kind of those used for assessment and intervention, because essentially the Mazi tool is, it's an assessment, but we're using it as an intervention to kind of raise awareness, build understanding, build capacity. And then we have in our research used a whole lot of just tools that are just for assessment. So for example, executive function, we've used a set of tools, the early years toolbox, that's a set of iPad games. And so from a purely assessment point of view, I mean, they are really scalable. We translated the early years toolbox executive function tasks into multiple languages. We used it across a range of different communities. They're often really simple to use. They're quite intuitive and, available to use for a student or a field worker. You don't have to be a trained assessor or an OT or a psychologist or anything like that. So in many ways, they're scalable because they are really easy to use. You're kind of taking out a lot of the scoring and those kind of things that add like a cognitive load to the person doing the assessment. And, you can standardize a whole lot of things like timing and responses and those, instructions and that. So, and I guess where something like Mazi fits in is that as a assessment / intervention, or assessment for the purpose of intervention, it still very much relies on people, and it's got to be used as a tool. And just like any other resources you would have in a learning environment or in a home, like you've got to learn how to use the tool. You've got to understand what its value is. How does it support your other things? So I'm probably, maybe I haven't been in the tech space long enough, but I'm probably one of those people who doesn't believe that, there's a tech answer for everything, but that they can be very scalable and effective tools in a toolbox, and they can't be used in the absence of kind of good people and relationships. And so even for us as researchers, there's no way we could go out and use it at scale. But partnering with organizations like Do More and like many others that we've worked with in the country, they're already working at scale. And so you're giving people working at scale an easy tool to use in their hands that they can then kind of take it to scale. And obviously at a center, there's lots of children. So there's kind of levels of that scalability, but it really does, like you can't use it without the people. And even in what we've learned as well is that you're relying on someone answering questions about a child. Some of the questions are to the child, and some of them are either to a caregiver, or now we're piloting, can the ECD practitioners answer this? So it also relies on their understanding of the questions, even if they're translated. Does the whole notion of assessment make sense to them? What do they do with that information? Do they answer the questions honestly? So there's so many human factors as well. So I think it's helpful to put those in perspective and then leverage on that kind of human and system level, like where are there opportunities for scale, and how does having like a really easy and appealing technology or digital tool add value to what they're already scaling.
Everything you're talking about just makes so much sense as I'm walking through what you are aiming to achieve. I wonder if you could share maybe like a specific example or a case study of some sorts where this digital tool, or anyone I guess that you've heard of, has significantly improved the assessment process or outcome for young children. I mean, maybe just a few stories of Mazi would be awesome.
Yeah, I might go back to the early years toolbox. Well, I can talk a little bit about both. So the early years toolbox, it was the first time executive function had been assessed in this age group in South Africa. Loads of the information we know about executive function comes from, the minority of the world's population of children. And so what we actually found in using this, when I was first exposed to it, I thought, well, kids, like our children, they won't know how to work a tablet. Like it's never going to fly, But then as we kind of explored it more, you realize the different paper-based tools, like those, and as I've learned more about assessment, like those assume a certain level of like numeracy skills or literacy skills. They assume that many young kids are used to interacting with an adult with like a piece of paper and a pencil, which for many kids, particularly in our rural areas, is very intimidating. And it feels very classroom-like, whereas an iPad is like a game. And we found
fun.
It's so fun because they don't have an iPad at home. So now some lovely white ladies that come from Cape Town are now letting them play on the iPad. And even in the studies that we've done more recently, one of our field workers here in Cape Town, they call her teacher computer because she comes to do the assessments with a tablet, and they just think this is great. So we have zero compliance issues, just about. So because the kids really enjoyed it, like they were engaged, and then we actually found that the kids did much better than we thought they would. Not just because it was fun, because the tasks still tap into like a certain cognitive ability. But when we compared our data to data from Australia, where the tool was actually developed, like some of our kids in rural Mpumalanga on some of the executive function components did better than the high income kids in Australia. So it really kind of changed in some ways the course of our research, because all the research that we'd read, mainly from North America, saying, poor children have poor executive function and they're kind of doomed, and executive functions like the answer to everything later in life. And we saying, no, actually, I think it looks a bit different here, because these kids are actually doing better than expected. So they have the ability to learn. The environment is just not necessarily harnessing that. So it kind of really changed the narrative for us, because as you can imagine, working in really challenging settings, often you get really discouraging results. So to actually get really positive results was really encouraging for us, and helped us to see, hang on, maybe things are a bit different here. We are still trying to figure out why the executive function skills are higher than expected, but that's kind of really, really shaped things. And I guess from the Mazi point of view, when we did the pilot in 2023 with home visitors and how they then used it with the caregivers and the children they were working with, just, to have their feedback on kind of how the questions kind of really stimulated their own thinking. And even in just training the home visitors, saying, well, we didn't know this for our own children. Like, I wish we'd known this for our own children. And just seeing the changes in their own perceptions and mindsets, seeing how those shifted. And I don't know if we can attribute that to the fact that it's a tool on WhatsApp, but a tool on WhatsApp's quite cool. And it's maybe a little bit more fun and engaging than something on paper. And so I think it's using the leverage of that, and it's something that is a little bit more playful and colorful and engaging, are ways to kind of improve motivation to actually use something. And once it's used, then seeing kind of the positive impact on the individuals, and then how they talk about their interactions with children is really, really encouraging.
Immediately you think of the digital like kind of literacy, but it's amazing to hear that that's so overcome, and even in the rural areas. I wonder, like, to speak to a few more challenges. Are there challenges around data and signal connectivity and those kind of things? What other challenges have you experienced with these tools?
All of the above. So when we were piloting the first time, it was when we were having terrible load shedding. And so, the networks were very frequently down. So we had lots of paper workarounds. And data is a perpetual challenge, because even though we've designed it to use really small amounts of data, it is just a barrier. If you're giving it to someone, say, well, could you now use this? Even if it's only going to use like a few hundred megs, the perception of like, but must I pay for that out of my own personal data? Or so it's, and you understand that even if it's a small amount of money, if that small amount of money could go towards meeting you and your family's basic needs, like, we have to overcome that barrier. And so, using it on WhatsApp obviously means you need an internet connection. And so providing data is a cost that we've built in, whereas other, tools are maybe built on a separate app, and the app is then data free for the user or whatever. So one way or another, you have to overcome the data issue. Obviously, network connectivity is still an issue in many areas, particularly rural, but even in some urban areas. So some of my other work is in Soweto, right outside Joburg, and the network is often terrible there. And there still are in urban areas just kind of, I wouldn't call them hotspots, but like cold spots, maybe where the network is really bad. So that is a challenge. And even though I think the digital literacy in many ways can be is improving, like, it is still an issue. And I think as we've worked on different iterations of the tool, we've just simplified and simplified and simplified. Made the buttons easier and more intuitive, and just taken out some of the explanation, or taken out some of the questions. So and that's the joy of doing a pilot, is that's the whole purpose of figuring it out. And we think it's super simple, and then when you explain it to people, you're like, oh, actually, we could still make that even more simple. And not because people are stupid or not intelligent. It's just when you're juggling a bunch of things, the little things that make so much sense to us when we've kind of been living and breathing it for a number of years, you have to then think, how does this come across to someone totally new? And even, doing the training last week, I was like, oh, okay, I think some of those questions we could probably take out, because they seem to have value for us, but actually just don't work super well. Not necessarily the assessment questions, but the kind of the in-between ones. So many challenges. And when working with people, particularly from California, that we have to explain, well, not everyone has a functional smartphone or an iPhone, or, data is very expensive, and we don't have Wi-Fi. Because I think the phones as well is an issue. So that, people may have a smartphone, but it's not very big, or it's not very fast, or you don't have Wi-Fi to update your apps. So then, the videos aren't going to play in the same way. So one of the things I think you guys do really well for the workshops that I've seen is having a hotspot where people can connect when they come in for training. I think is maybe seems from the outside a really small thing, but it's massive, I think. Even if it's just saying, I know, these things may cost, from our perspective, a little bit of money, but understanding how does that kind of fit in with other people's priorities, I think, is really important.
Yeah, that's awesome. And thanks for highlighting that. Well, shout out to the community team there. But yeah, I guess looking ahead, what innovations in digital assessment tools excite you the most? And are there any emerging technologies that you believe could transform how we measure and support learning in these communities?
Obviously AI is like the flavor of the month. And I think where, or maybe not the flavor of the month, it's like where things are going, and AI is obviously embedded in loads of things. I mean, a chatbot is AI, so there's so many things that we use already. I think really for me where technology has value is like, how can we take the load off the practitioner or the home visitor when it comes to calculating scores or figuring things out? How can we leverage technology to just make that as easy and kind of painless as possible, and not make people feel overwhelmed by, now I have to do this assessment and I have to mark it and record things. So I think the more we can use technology to record that, and so what WhatsApp's doing is just uploading the responses, and we can get a report and do much more on the back end. I think for me what's exciting, and just through some of the conversations we've had, is that are there ways, like particularly in the South African ECD sector, are there ways that we can kind of join the dots on the tools that do exist? Because I think every time a new person goes in and says, well, here's my tool, and I'm going to do training for my tool, and then they're like, but is this the same as the other tool? And it gets confusing, and it's so clear to us because we've got everything in nice clear compartments, but working on the ground, it's so easy to become overwhelming. So I think where we can kind of join forces to say, how do we synchronize or kind of synergize some of these efforts, save costs, is a massive thing. So I know those kind of conversations have already started in some ways, and some of us are using the same kind of service providers to do stuff that I think we can work smarter. That ultimately means that whatever effort is going into developing digital tools, we're just boosting the chances that those get used. Because you can develop anything. We can develop any really cool stuff, but it's whether people actually use it. And it comes back to the human element, and where we've built good relationships with organizers, with end users, we've built trust, built confidence and competence, then we really maximize all the effort and resources that we put into developing these tools. And I think the more we work together, the more we can, boost the chances of that happening.
Yeah, and I love collaboration on that. That's really awesome. So our final question for our listeners who may be in research, or our practitioners or donors, whoever's interested in early childhood development, what advice or key insight would you share about working in this space?
Connect with people that are doing amazing stuff. And it's often the challenges feel really insurmountable, and there've been many occasions where it's just heartbreaking what you see in terms of the realities of what children live with and are faced with, and the inequities in our country. But just finding those people and those organizations that are really doing so much to overcome that, that is my happy place. You find so many of those people in rural areas, which is why I continually seek out work there, because they just, every type of area in South Africa has its challenges, but I have a special place in my heart for people working in rural areas. So.
Oh, that's awesome. Yeah, well, let's get our listeners out of suspense on your playful check-in question. What is the most random thing you've packed on your travels, or something you've forgotten?
I would used to say, well, I can't travel anywhere without my hairdryer, but I've managed to get beyond that. I did forget I didn't forget. I think I lost my luggage once, and it was like my whole entire toiletry bag, and I had to just restock everything at the Woolies at OR Tambo, and then do like a well, and I think I've lost my luggage once on the way to Mpumalanga, and also just was doing a video and I had no clean clothes anyway. So there've been those instances, but I've probably forgotten a few plug adapters over the years, but nothing too major.
Yeah, awesome, Kathy. Thanks for joining us and sharing your wealth of knowledge. It's been so awesome, and we're so excited to collaborate going forward. So see you soon in our circles as we travel, and probably at the airport is most likely to catch you.
Yeah. Thanks for having me. And also really look forward to working more with you guys.
Playtime.